Sometimes people have more than one surgery at the same time. Sometimes people come for bottom surgery, but they would also like to do facial feminization and maybe top surgery. We can get it all done during that week, the first week that they're here, during that hospitalization. If they're going to do GRS and it takes us around 4 hours, sometimes I'll do a breast augmentation at the same time, or a trach shave, thyroid cartilage reduction, or maybe a rhinoplasty. But we're limited. I don't think that it's safe to stay in the operating room for more than 7 or 8 hours at one time. Then you start running the risk of too many complications associated with just laying on the table for a long period of time, like phlebitis or, God forbid, a pulmonary embolism. So 7 to 8 hours is about my maximum, although every once in a while I've been in longer than that, but I don't like to do that. Well, frequently, if someone wants to do everything, we'll do the GRS on the first day, the day that they're admitted. We'll do the bottom surgery and maybe a breast augmentation or a trach shave. And the next day, we'll just go right back to the operating room. They already have the IV in. All they do is put them to sleep through the IV and they just go right back to sleep again. It is no more risk. People can have general anesthesia 4 or 5 days in a row at 0 risk, unless they had some unusual problem, and then we wouldn't do it, of course. I've never had to do more than 2 days because we get everything done. So one day we do the bottom surgery and maybe a breast aug. The next day they go back, they just go right back to sleep, and I can do all the FFS, forehead contouring, removing the bony balsi, brow lift, hair advancement, rhinoplasty, give them a feminine nose, upper lip shortening, chin augmentation or reduction or narrowing, mandible contouring, and anything else. If they're also going to do eyelids and a facelift and liposuction and a tummy tuck, well, then we would need 1 more day. But we don't usually do all that at the same time. Sometimes people had their GRS already and they're coming just for the facial and body surgery, so that we may do 2 days of that, because if we're doing all the procedures I just mentioned, plus the facelift and eyelids and a tummy tuck or liposuction, and it's going to take more than 7 or 8 hours, well, we'll divide it up. We'll do 4 hours one day, 3 or 4 hours one day, 3 or 4 hours the next day, and that's it. Stay in the hospital maybe 1 more night and go home, depending on what they're doing. Most of the facial surgery that we do, and breast surgery, we don't stay in the hospital. We do that on an outpatient basis. We go in the morning, and I bring the patient home myself that afternoon. We only stay in the hospital when we do the bottom surgery.